Your health insurer's right to recover its medical costs for your treatment is spelled out in your insurance contract. The first order of business is to understand the type of coverage you currently have or expect to have in the future. In the U.S., there are many ways to obtain health insurance. 3 of the most popular are Medicare, Medicaid, and private, or employer-provided health insurance. Medicare. Medicare is the federal government's health care program for senior citizens. Medicare provides health care for those 65 or older, or those under 65 who are disabled, suffering from permanent kidney failure or end-stage renal disease, or diagnosed with Lou Gehrig's disease. Medicaid. Medicaid is the state government's health care program for low-income folks who can't afford to pay for medical care. More than 60 million Americans are on Medicaid. Each state has its own Medicaid program, so the laws for Medicaid may vary from state to state. Like all state or federal programs, Medicaid's reimbursement right is based on the law or state's regulations governing it. You become obligated to follow your state's Medicaid rules as soon as you receive your first dollar of coverage. Private insurance. Private health insurance is administered by many different insurance companies. Most Americans on private insurance get their coverage through their employer. These are often referred to as ERISA plans. For this type of insurance, lien obligations most often arise out of a contract between the client and the health plan.
What is a healthcare network? It is a group of physicians, hospitals, and other healthcare providers that agree to provide medical services at pre-negotiated prices and rates. This often means significant savings for you. The larger your insurance company's network, the more doctors and hospitals you can choose from. When you are part of a healthcare network or a preferred provider network, you will likely see reductions in your premiums and out-of-pocket costs when visiting medical providers in-network. You can still visit any medical provider, but if you choose to get services from someone that is not in your preferred provider network, you will likely pay more. As you can see, using providers in your healthcare network or preferred provider network can offer you significant savings. That's a healthcare network. Size definitely matters when it comes to your network. When you are part of larger groups, they can negotiate with medical providers for lower prices, as well as provide you with the most choices in doctors and hospitals.